Hello friends, welcome to my channel. Today I'll explain you on a topic of double Maddox rod. Coming back to the extraocular muscles, you can see in these pictures all rectus as well as oblique muscles and their action. So basically torsional muscles which act on this test. So superior rectus muscles in this secondary action shows a intorsional movements, and whereas inferior rectus muscles in a secondary actions shows the extorsion movements. But when we are talking about the oblique muscles, that is the superior oblique muscles and inferior oblique muscles, we shows in a primary action shows the intorsion for superior oblique and extorsion for the inferior oblique muscles. Double Maddox rod, basically it is a subjective test which use two Maddox rod, one before each eye. Basically, this test is used to determine the cyclodeviation and torsional movement of your eyes muscles. The test can be done in all the position of gaze for comparisons. Now, red Maddox rod is placed before both the eyes during the test. Place each Maddox rod in the trial frame, aligning the groove of the rods at 90 degree, making the red line streak seen by the patient horizontally. The procedure of the double Maddox rod: a room light should be dim and make sure other light sources do not disturb the view of the streak for the patient. Use a short spotlight at a 33 centimeters at the bridge of nose at the eye level for near measurements, and for distance use a source of spotlight at a 6 meter. Ask the patients what the patients are seeing on a double Maddox rods that you can see in this picture. Ask the patients to show the orientation of streak and then place the loose prisms in the trial frame. If the patients do not have any vertical and horizontal deviation, streaks can be difficult to compare. Then thus loose prisms can be used to separate the image and streak to let easy comparisons. If the patient has a large horizontal deviation, prisms can be used to bring the streaks closer together. So examiner can either use base out, base in, base up, base down prism depending upon the deviation of the eye. For example, if a patient have a esotropia, they may need a base out prisms and bring these deviations close to each other with the help of the prism. What are the things that you need to ask the patients? Ask the patients whether the streaks are parallel to each other. First, if the two streaks are parallel to each other, patient does not have a cyclodeviation. Second, if the patient sees the streaks are not parallel to each other, rotate the Maddox rods or ask the patients. Third, to rotate the Maddox rod with the help of dial in the trial frame to make the line parallel to each other. Recording degree taken from the 90 degree. When a Maddox rod is vertically in the trial frame, then you can rotate either 10 degree toward the nasal side and 10 degree toward the temporal sides. You can see in these pictures the Maddox rod rotated at 100 degree. It means the patient has a 10 degree excyclo deviation. If Maddox rods rotated at 80 degree, the patient has a 10 degree of encyclo deviation.